Hello, and welcome to Becker's 18th Annual Spine, Orthopedic, and Pain Management Driven ASC Virtual Conference. We are excited to have you join us for today's session, Digital Health Platforms, Guiding Patients from Pain to Recovery, sponsored by Smith & Nephew. Before we begin, we would like to go over a few housekeeping items. You can submit any questions you have throughout the presentation by typing them into the Q&A box you see on your screen. We look forward to hearing your questions. You'll also find a few other engagement tools on your dashboard. Be sure to check out our resources section and fill out the event survey. Finally, this session is being recorded and will be available on demand following today's event. We will send you instructions on how to access the on-demand recordings once today's event concludes. Today, we are thrilled to welcome and turn the floor over to our presenter, Kaushik Gunay, Vice President of Digital Health at Smith & Nephew, to begin the presentation.
Hi, my name is Kaushik Gunay. I am the head of digital health at Smith & Nephew. And as part of digital health, we are building a big digital health platform that is designed to solve patient, physician, and payer needs throughout the entire care continuum of the patient, from the onset of pain to all the way to the surgery and all the way to recovery of life, fully unlimited. Today, we will be talking about one of the products within that digital ecosystem called ARIA, which is a patient engagement and care management platform that allows care navigators and surgeons to interact with their patients and manage their patients' care from the time they enter their practice and office to the time that they fully recover from whatever care that they receive, and they restore, their life fully back. Before we dive into, the technology and the product we have to offer, the context that we are living in today is patients want healthcare when they need it and where they need it. COVID has clearly accelerated that and shown us that more and more patients want care to be delivered in their home or at their convenience. They want care delivered when they want it, while managing their day-to-day life, whether that's a work life or family life. And they want it delivered in a very easy and convenient way, a way that does not require them to change their lifestyle. And so as we think about care delivery, the healthcare evolution needs to think about outside of the box ideas. And what we're going to present today is one such step towards that out of box thinking. At Smith & Nephew, our digital ecosystem starts from the time a patient has a pain. It engages the patient. We have tools that enable pre-op planning and simulation, robotic surgery, post-op assessment to see how the surgery was successful. And then also, rehab, which is a key component after the surgery, helping patients, recover from their surgical episode, and then all the way to measuring outcomes 3 months, 6 months, 12 months after the surgical episode. Today, we will focus largely on the top two buckets where our solution, ARIA, is focused on. So the reason we built ARIA is because a lot of surgeons and clinical managers complain to us about their issues of managing care. And a lot of those issues landed outside of the OR. We heard a lot about how difficult it is to manage communications with patients, the number of phone calls that care navigators or nurse navigators have to do with their patients to get them to do something or to inform them about something. The difficulty in keeping track of collecting and keeping track of patient-reported outcomes was another big concern, especially when increasingly more and more payers are asking their providers to collect this data and report this data as a measure of continuous improvement in outcome results. And finally, a big concern was around every clinician explained how they have good patients and not so good patients. And essentially what that boiled down to is an engaged patient following the protocols, following the recommendation, following the prescription versus a patient that is not. And that increase concerns about readmissions, concerns about complications. So we built a tool that enables patient to engage with their care and with their care providers. We built a tool that allows the clinicians to engage back with the patients and manage their care navigation end to end. And we saw some good results when we tested out, our tool in a couple of hospitals in terms of, ability to reduce readmission rates, ability to, reduce post-acute care costs, and also a total, episodic cost. And so I'll talk about how we did this. We started first with patient engagement. When we think about patient engagement, the first thing that we optimized around is meeting the patient where they are at. What I mean by this is when we ask patients to engage with the technology, each person has his or her preferences in terms of how they want to engage with technology. Some like iPhone, some like Android, some like smartphones, some still like an email or a text messages. So our technology is agnostic of any way that patients would like to receive this communication. The second piece is how do you enhance patient experience? Now that the patients are engaging on the technology, how do you keep them engaged? And our product has several patient assessments, patient goals, patient reminders, educational information and videos that keep the patient engaged on our app and on our platform. And through that, we are able to drive patient compliance to whatever protocol that the clinicians or the care provider team wants the patients to follow. And in addition to this, we also enable our device to talk interact with other wearable devices like Apple, Fitbit, Nokia, through which we are able to record, activity level data and feed it back to our providers. And so when we look at our patient, population using this tool, we see a very high level adoption and engagement in that because of these four kind of, enablers that our app provides to the patient. On the flip side, when we think about our care navigators or care providers who are managing the patient from start to end, we have designed a web-based dashboard for them, whereby they can get onto any laptop, and as long as they have an internet, they can log into their portal and really start managing patients by exception. What we mean by that is today, if a care navigator is managing 80 patients, they're probably going into each patient's file and trying to figure out, what they need to do for that patient today, tomorrow, and the day after. Our software, automates all of this and segregates the patients who are staying on track and no activity or no follow-up is required, and patients who are not following on track, and highlights those to the care navigators. Not only the software does that, but the software also kind of prescribes exactly what those patients need, whether it's, hey, this patient has not taken the survey, or this patient has not submitted, certain, insurance information. And so it simplifies the world for the person who is managing these patients very, very well. and it allows the care navigator to focus only on the patients that need more help versus less. And we are able to do that because we allow the care navigator and the surgeon and the physician to design their own pathways. And those pathways determine, tell the software what the patient should be doing and what the patient should not be doing. And that triggers, the alerts to the patient as well as to the care navigator. And so this allows, and we've taken this even one step further. And we have said that the care navigator not only is dealing with the patient, but is also dealing with multiple providers, whether that's, anesthesiologist, whether that's a physical therapist. Our software provides the ability for the care navigators to pass on the patient to another provider, gets full visibility into what that provider is doing or not doing, and allows, to intervene if necessary, if the other providers need help or needs communication. So ARIA also allows and simplifies PROMs collection. Because it engages with the patient, throughout their episode of care, and its ability to customize any surveys that the care team may want, we can deploy this data collection before surgery, after surgery, 12 months after the surgery. And so it stays in connection with the patient throughout their journey 24/7. And on the back end, it collects all this information and reports back to the provider in a dashboard way, as well as in a report formats that can be then used to submit it to their insurance providers or other entities. The other thing ARIA enables is helping make certain, important decisions. One of the things that we've heard from providers and surgeons is how do we select patients and the site of care for those patients? Which patients are more appropriate for a hospital setting because of complications, versus which patients are more suited for an ASC or an outpatient setting. And so we have a tool that pulls from about 200 published clinical research papers, and it boils down to a set of survey questions. When answered by a care navigator, it provides a directional view of whether the patient will be good or not good for an outpatient setting. ARIA also has a costing mechanism that, based on past reimbursement rates, based on bundle payment structures, and based on underlying cost drivers, it can predict for a given patient how much what the total cost of episode will be. And this information could then be used to decide the best approach to manage costs while you're optimizing for outcomes as well. And so in a nutshell, ARIA is a tool that begins with patient engagement. It is the easy face for communicating with your patients, but also making sure the patients are staying engaged and up to date as they progress through their episode. It's a tool that allows the care navigation team to focus only on the patients that are falling behind, and allows them to take quick action, thereby increasing their efficiency and the number of patients that they can see and manage. It allows them to coordinate between providers, reducing the back and forth between various providers that may be supporting a particular case. And it makes PROMs collection very easy and very convenient from a reporting perspective. The one other thing that we've made sure that our product does is seamlessly integrate with any EMR that the practice may have or that the practice may choose. We understand that no provider or no user likes to enter the same information in two different systems. It's laborious and very inconvenient. And so our app makes it easy by seamlessly integrating into the EMR and pulling as much information as it can that already exists. If you would like more information, please reach out. Go to think-aria.com, where you can see as a patient or as a provider the information you need and contact information if you have follow-up questions. I look forward to hearing more as we evolve our care management platform and as we evolve, healthcare for the better future.
Great, thank you so much. That is all the time we have for today. We want to thank Kaushik for your time and insights and Smith & Nephew for sponsoring today's session. And to our attendees who joined us, thank you for making time to be part of our Becker Spine, Orthopedic, and Pain Management driven ASC virtual conference. We look forward to seeing you at future Becker's events.